placid 67-year-old man who has cancer in several places, including both lungs, in critical condition. Breathing is vital. Coughs and phlegm. The old man cried out many times, "I can't breathe. Water, my mouth is dry like sandpaper. Help me, please, help me." Imprisoned, held captive against his will. The hospital area quiet. Curtains closed around him. The man could not see out there. It was like everyone had gone home or to lunch or anywhere. He could not move at all. For about 3 hours, long hours, this dying man, cancer in both lungs. For 3 hours, was spread-eagled, put down, laying flat on his back, flat as a board. Couldn't move. His left and right ankles were shackled to each side of the hospital bed's metal rails, using 50mm wide heavy-duty straps locked in. His left and right wrist were shackled to each side of the bed's metal railings, using 50mm wide heavy-duty straps locked in. Spread-eagled for hours and hours, phlegm coming out of his lungs, difficult breathing, lung cancer in both lungs. Completely, he thought, was left for dead. No one there left with him, this dying old 67-year-old man. This is at Westmead Public Hospital. He was tortured there. I'll give you the background of it. After a horrific incident within the sanctuary of this old man's home, where his carer, loving, trusted family carer friend, many years, was a little concerned that this old man, spending the last 3 weeks or so on the computer, happily doing legal work actually, and getting quite productive and enjoying the legal work he was doing, and but taking naps during the day and things like that. And anyway, the carer, she rang up the ambulance paramedics, and in the past they'd come and really looked after the man and spent quite a bit of time here with him. And they said, "I'll call us back any time you need us," and really caring, devoted paramedics. And anyway, the carer, she called the ambulance, AAO, and said, "Look, situation, he's not sleeping, and a bit worried about him, and they requested paramedics come out and see him, with his medical condition. He's death imminent any day or week. Anyway, the triple O called ambulance paramedics, and paramedics entered the man's his home, safety of his home sanctuary. This was on the back of a previous paramedic named Myra, who had come in and verbally abused this dying old man with the presence of the carer, and she objected to the house having CCTV cameras and audio recording cameras. So this was on the back of that. These two paramedics, the male's name was Brendan, I believe, and not sure about the female's name, but they didn't bother to ask about the man's paramedics, about the man's, tongue twisted, about the man's drugs that he was taking, prescribed drugs, and they were just hell-bent on taking this man away with him. And normally the paramedics, the first thing is they look at the medications and excuse me, they check it out and make sure everything's going good. And had these two paramedics not been so preoccupied with an obsession to take this man, drag him out of his own home, they've had a look at his medication and sat there, politely and friendly, and gave a little counsel to this man and say, well, look, the man had told the hospital he's missed out his overlooked taking the Zoloft, 200 milligram of Zoloft the day before. Anyway, it also has Valium there prescribed, 5 milligram, which, takes occasionally, avoids it, because he sleeps okay, but if he can't sleep, you take half a Valium tablet, 2.5 milligram. And these two paramedics, the male and the female, if they had discussed it properly with the carer and the patient, and looked at the medication and said, look, take half a Valium or 1 Valium, and just sat there with him for 20 minutes and he would have been snoring. The man, he was just overworked, tired. It happens to all of us. Get a bit burnt out and typing away, doing legal work on a computer, on a monitor, and time flies and people do become a bit robotic. It's not unlike driving all through the night to Melbourne in the old days. The roads were crooked, and by the time you get there, you weren't Mr. Personality, you were buggered. This man was buggered and he just wanted to have a bit of brekkie and take his medication and have a nap during the day. Anyway, the paramedics, they wouldn't hear of that. And they started to basically demand he go with them and didn't want to discuss anything. They failed in their duty of care to this patient. And this man's deeply religious, prayerful man, Christian man, Catholic actually. Catholic icons in the house. And the paramedic Brendan said to the man, if I pray one Hail Mary, will you come with us? And the man's very disturbed at this sort of conduct. He said to this Brendan, the paramedic, you could pray 1,000,000 Hail Marys. He said, I'm staying here. And this is on the back of Myra, the paramedic there, coming around. The man thought he was having a heart attack. And she's abusing the man, because, over nothing. Over nothing, basically. Anyway, the paramedics both were ordered out of the house, because the only reason they were called is about his sleeping, and just, if they had asked him a few questions and looked at the medication, would have resolved the issue there and then, but they didn't seem to want to do that. So anyway, they were asked to get out of the property, get out of the house, and the front gate was locked. And then the next minute, they've called the police riot squad. Two young police officers in a black Nissan Patrol, flat black painted Nissan Patrol, with their Glock pistols and 9mm Glocks, got out and come. And anyway, but they come back in the house. The paramedics, they weren't wanted in the house. They come back and try to blow it up as some sort of domestic violence, or the bloke's paranoid and got to take him away. And this is in the lounge room, sanctuary of his home. The two police officers there that didn't look like they didn't really know what they were there for. The bloke was a medical case, and obviously no huge danger to anybody, really. There's two fit paramedics. Could have this dying old man. He'd got perhaps weeks, even days to live. And this incident happened on the 16th of July. Anyway, the paramedics against the old man's. We wanted to stay at home. That's his sanctuary, and enjoy the rest of his life he's got. He doesn't want to sleep at night and wants to sleep in the daytime. And the paramedics think there's something wrong with it. Well, they should just need to walk up the street here in where we live, and you can see a lot of people there walking around very strange, drug addicts, methadone, Anyway, the paramedics blew it up out of all proportion. It seemed that the male one was the dominating one pushing it, and they took it upon themselves, it seems, and put a section in place. This is according to the discharge summary. There was a section in place. Now, what needs to be answered? Who put this so-called section in place, and why? It needs to be in place. Why would anybody do that if they hadn't done their job correctly and checked the medication? It's just common sense. Placid old man, both lungs, cancer, and all that through his body. And they shackle him down. Could have died there. No one with him. And they left there for hours. These are two doctors, apparently, I don't know exactly, but they're two doctors. They said they were neurologists. Anyway, there's a good long story to it. I just don't want to go right into it now because I don't want to make the movie too long. But the way they treated this man, He's left there to urinate and do feces in the bed, head facing up at the ceiling, crying out for help, and left there for hours. You know, could have tied him up out the front on a gum tree with some rope. At least he could have done his urination and the feces there and just onto the ground. This is these two doctors. And one I think they claimed his name was David, the other one Sonny, younger. Looked like they come from they're not Australian, not Caucasian, but anyway, they subjected this man when they finally come back. He said, I need to do wee-wee. And one of the doctors come over, he put the urine plastic bottle, chucked it down between his legs. And there's no way he could have taken his penis out and pulled his tracksuit down to put in that bottle. And he asked to be, unshackled, not a danger to anyone. And he asked to be unshackled, and they wouldn't do it. And he finally come back again, the same so-called doctor. He humiliated the old man, pulled his tracksuit pants down and his underpants, which were already wet because of urine coming out. And he got the man's penis, held it and put it in this bottle. And the man, filled the bottle up, and the doctor just walked out, took it with him, and left him there, shackled. This conduct, they've imprisoned this bloke. He'd been held captive against his will. He couldn't see out. Everyone had gone. I know myself, numerous times I've been in hospital and prisoners from the jail come there, and they've always got someone with them. The prisoner needs any assistance, it's always there. And I've noticed they just got a handcuff onto the bed or something, not hog-tied, spread-eagled. It was, and to make it worse, his carer was distraught. She's waiting for 3 hours outside, and the people there, the emergency people, wouldn't let her in. She knows this man better than anyone. She only called for help, the ambulance, because he wasn't sleeping, wasn't violent or nothing like that. And she remembered the good paramedics had come in and, have a good chat with the man, and like they did before, take him out and have a walk around the backyard. And it was a win-win for everyone. But no, they, these two paramedics took him over there, and this man was up in arms about it. No one would be happy like that if you have like Gestapo-like people come into your house. A blatant abuse of police use. There's no need to bring in the riot squad with the big black Nissan Patrol, flat black there, and big guns hanging out into the lounge room. I mean, this is his private home. This is his home. Purchase. That's his sanctuary, safe. And they do this. It was, and then they put a section. What's this section that mean? Who did this? Who took it upon themselves to put a section in place, and why? And I'll just read some of this absurd discharge summary, which it's a false document. It's been, I believe it's been, it's on the back of other complaints that he's made there that are well-known complaints that have been fobbed off and not listened to and ignored and swept under the carpet. He's written to the Chief of Executive Graham, or the General Manager Rebecca Tyson. He questioned Rebecca about her so-called investigation into what had happened to him, and that's all documented. And they, not even the courtesy to reply back to him, not even the courtesy, which is basic stuff. You know, this is the patient there, and these people have just stripped him of his rights, and they do it with anyone. But anyway, the discharge summary, it was, it's the consultant there, my understanding, she's the head honcho neurologist department. She's right up there, number one. Her name's Ha, surname Ha, Amy Ha. Anyway, Amy had interviewed this poor old man after, you know, he'd been subjected to brain scans, procedures, needles stuck in his spine, bandages still on there, all of this and questioning and doing pictures and diagrams. You know, these two so-called doctors and the nurse or whoever there's with them, you know, they realise there's nothing wrong with this bloke. And they unshackle him. And it now looks like, you know, they're covering up again. Because they don't go into detail here, and the devil's in the detail. Anyway, this consultant, Amy, the patient found her to be very reasonable Chinese lady, but spoke like an Aussie and was obviously very well trained. And she checked him out, and it all seemed well. And he said, "Well, can I go home now?" You know, and this is the same afternoon. She said, "Oh, well, the other doctor, they've called a mental health team in, and they've got to have a look at you." And I said, "Well, there's no need for that." Oh, she said, because they've got this section in place. Anyway, you know, obviously, Amy Ha, you know, she's not stupid. She knows what the man's going through and what he spoke, and he's answered all their questions there. There was no reason to subject him to a procedure and putting a big needle in his spine. The man complained about it. He said, I don't want that. But the doctor said, "Look, if you do this, we'll let you out in 15 minutes' time. You can go home. We just want to check if something's gone into your brain." Just ridiculous, you know, if the cancer's there, and it's just absurd. And he said, you know, they pressurised him. So he said, "All right, if I go home in 15 minutes. And he said, "Are you sure? You promise?" He said, "Absolutely," they said. You know, we get the checks done and you're out of here. They're just lying. And being said here will be said under oath, under cross-examination, any witness box, at the appropriate time. Now, anyway, Amy Ha, and 3 days later, up in there, the nurse there, Troy, was good, and they're having, you know, good conversations. Troy was one of the rare ones there. He's blessed, he's gifted with social graces, knows how to have a talk. They discussed a lot of things, and Troy was very helpful. Even tried to get him another pillow, but they don't have them. So, but anyway, emergency department, for a man who's had no sleep and needs sleep and just a bit of a rest, you wouldn't put your dog in there, even the so-called new hospital. Anyway, eventually he was taken up to the oncology ward, CB or something, not too sure, and he was greeted there and treated with kindness by all of the nurses there. Harry, one of the guys there from Ceylon, Mahendra, one of the, I think, had a bit of status, a manager, nurse. And, a lot of sick people need to get in there. And they would say, well, what are you doing here? You should be at home, nothing wrong with you. And they weren't just pacifying, they needed the bed. This man, all he needed was a bed at home and a good night's sleep. And just when he gets on the machine typing away or whatever, just, an hour or two at a time, then have a break for a couple of hours and just get into that routine. But people get carried away on these machines. Like I said before, they can be robotic. So anyway, when he was discharged, a psychiatrist there, very talented, also Chinese psychiatrist, but very talented, older gentleman, and had Chinese accent, but very, he spoke to the man, and they went for a little walk, and the man explained, look, I've just been mucking around on the computer doing work, and got carried away, and explained that I forgot the Zoloft there, and blah, blah, and he didn't hesitate. He said, look, you go home, you don't belong here. They shook hands, and, he was a terrific bloke. So at any rate, I'll just try to flick through this. They claim here, reason for presentation, they've got one word, agitation. Well, if that happened in your house, I think that you'd be a little agitated too if the same thing happened. No doubt the judge in court wouldn't like it himself. And the police officers, they were good, but you see that they thought, what are we doing here? They had the video recorders going. The man didn't care if they recorded him, he was recording them. In the house, on the house cameras and on his own iPhone. All he wanted was a good sleep. Anyway, says his agitation, community health, experience symptoms. They always put in a bit of filler here, to try to distract you with these, like the other two reports about Dr. Lowe, Kelvin Lowe, and Dr. Mee Ling and Cheeseman, the complaints that just fell on deaf ears. And we're not going to allow this one to fall on deaf ears. Yeah, so we want answers straight away. Anyway, discharge, fall, ooze, swelling, blah, blah, blah. Diagnosis, principle. This is a good one, and it's additional, they call it, underlined. Behavioural concerned, in brackets, ED suspected. Now, they're referring back to, obviously, to Dr. Mee Ling, who threw this man out. That's all documented. Inappropriately, threw him out of the hospital. He had a full drip. And Dr. Kelvin Lowe dehydrated the man amongst things. He tried to complain to Rebecca Tyson, Graham Lowe, and all of their handlers. Didn't listen, didn't want to hear the complaint. They had to listen to this man's complaint, gave him a fair hearing. The problem would have been resolved satisfactorily in everyone's very best interest. Anyway, behavioural concerns, ED suspected. So they're putting it on the back of these other complaints to say, look, the bloke's not the full quid. Ongoing with historical anxiety, depression, gout, hypertension, metastatic lung cancer, kidney and pelvis cancer. but they don't say the anxiety and depression was subsequent to the maltreatment and abuse that he received there at the hospital on the 5th of the 1st, 21, and on the 25th of the 1st, 21, and the subsequent, he's trying to get someone to listen to his complaint, and he was just ignored. This bullying conduct gives people anxiety and depression. They're trying to say it's a history, but they've exacerbated any problem he had before. And when he got the bad medical report, he was handling everything okay, doing the best he can. Anyway, I'll just quickly go. Altered mental status. Blah, blah, blah. Section in place. Here's where I'll just read. Called by carer to home because patient has not slept for the past 24 hours. You know, the patient just hadn't slept for, overnight. He missed a tablet, and for weeks he'd been napping during the day. He was tired. Then they indicate was agitated and paranoid about other people recording him. It's just utter bullshit, nonsense. You're just embellishing it to cover up. Liars. This man, he believes in cameras everywhere. He's got nothing to hide, but the hospital don't believe in him. He was calling friends and family consistently because he didn't want them to take him away. That's why. And there was no need to take him away and section him and treat him like that. They should have just looked at his medication again. So, looked at the medication. Here you are, mate. Take one of these. Take the full one, 5 milligram Valium. The bloke would have been snoring in 25 minutes. Agitated, paranoid, he's indicated normally disorientated. GCS 14 at baseline. Yeah, please explain. Patient was aggressive at the scene. Therefore, paramedics stepped out of the yard. They were told to get out and awaited for police. They called the police, ridiculously called the police. They were told to get out like that Myra paramedic was told to get out because she's in someone's home. You've got to show some respect. She's not in the hospital where they just kick the people around or give them their rights are taken. So that's what happened, and that can be under oath. They were told to get out. They weren't needed there. They only come there with the intention to take this man away, give him the Valium, and everything would have been beautiful. He was aggressive at this. I mean, he wasn't happy. Aggressive. Therefore, paramedics officers stepped out of the yard and called awaited police. What a crock. What a crock. Complete fabrication. The man had been working on a project, legal project, for 3 weeks. Just needed to have a nap, have a bit of brekkie and sleep. I got friends there, they stay awake all night and they sleep during the day. That's what they find that suits them. Who were these young paramedics to come in and abuse their powers and call the bloody riot squad in the form of TRG? What for? You would have thought that they'd come in and the house had been smashed to pieces and the carer was bloodied nose, or, the house, the man's got religious icons here, valuable, and the man, all he wanted was a bit of help. Called the carer, to just have a chat to him about the sleeping, and that's all. At any rate, I'll just go through this so-called discharge report. It needs to be written out again properly. You can't present this kind of rubbish to his doctor when it's absolutely. There he said the paramedic says upon presentation of police, patient more compliant with ambulance officers, more compliant with, well, that doesn't, not good. writing, upon presentation of police, patient more compliant with the ambulance officers or paramedics, has believed that police would shoot him if he acted out of the ordinary. And they give a direct quote, acted out of the ordinary, would shoot him. The patient said, look, he doesn't want to go. He wants to stay at home. Okay, he's pissed off. He wants to stay at home. He done nothing wrong. He wants to stay at home. He said to the cops there, the patient's friends, they're in the TRG. He said, look, there's been people, that have been dragged off, and if they run away, you're going to shoot them. It's happened, and the cops, young cops, said, "Oh, not us. We didn't. They haven't heard, but it's happened often. They shoot and ask questions later, and they've got the gun handy there, and that they choose to use that for whatever reason. Paramedics are just there, big Glocks there, and all the gear in this dying old man's house. And I'm sure that they would have been, well, this bloke, he's buggered, he's got days to live. Those guys, riot squad, they go to real tough jobs. The houses are smashed to pieces, guns out the doors. And all this bloke was, he didn't take a Valium, and he missed out on his Zoloft. And then everything's embellished at, anyway, I'll keep going through it. There's a lot of flaws in this report, and I'll go on too long now. They say he continues rambling religious themes during assessment. The man was terrified. He was praying the rosary, Holy Rosary, the Catholics pray. And these paramedic people in this report says he's rambling. Yeah? What if he was a Muslim and he was rambling and praying to Allah? Would they shackle him to the bed like that? He said he indicates he feels the fires of hell and is in the house of Satan. Absolute fabrication. It was the exact opposite. He's trusting in Jesus and he's in heaven. And he's got not to fear you people doing what you do. But to say continues rambling religious themes during assessment. The man just wanted to be at home. Dying days at home. Indicates he feels the fires of hell and he's in the house of Satan. Who would they write that for? It sounds like they're setting him up to section him good and proper the next time. It's absolute lies. Whoever's written that, I want to see them in the witness box, okay? And I want to see the audio and the video of what happened there at Westmead Hospital. And we know what's happened here in the man's house, in his home. He feels the fires of hell. He's in the house of Satan. Goodness me, these people are out of the trees. Rambling religious thing. You're praying a rosary. Oh, goodness me. Anyway, goes on, stoma in situ, tenderness, palpitation. Difficult to ascertain as currently rambling. Currently rambling. Well, really. Chest clear, nil audible crackles. They gave him brain scans, x-rayed his chest, give him medications, pumped him up with bloody more radiation, exactly what he doesn't need. And they say he's rambling, praying the rosary, Our Father, Hail Mary. And the paramedic was in the house, making a joke of this man's faith in this man's own home. He said, if I pray one Hail Mary, will you come with me? Anyway, it's presenting complaints, presenting with agitation, paranoid delusions, and behavioural disturbances in the context of missed dose of Zoloft and sleep disturbance, background metastatic cancer, blah, blah, blah. It was advised, they were advised, he's been happily working on a project for 3 weeks, doing legal work on his Mac. They asked about what, he told them no comments, none of their business. That's not here in the report either, but that's we've got that in there. And this will all be sworn on oath and in the witness box too. Now it goes on, lives at home with wife. The man hasn't got a wife. He's got a trusted friend carer there who's looking after him for his cancer and problems. And in fact, this man is looking after his carer too. She needs any help. Has been seen and cleared for discharge by MH. Who's MH? MH. Well, anyway. Seen and cleared by DC Palliative Care with thanks. And then they go, he's currently, I really, in bold, underlined, currently, he is calm and settled. Currently. He's always calm and settled, but when that happens to him or anyone else, they're not calm and settled. States he can recall most of today's events, but cannot recall in detail when probed. Disagreed with carer's recollection of events. And it is falsely stating that the man stated things got heated and she overreacted. Absolutely false. He advised them that she overreacted by calling an ambulance. There was no need for that. It says he denied feeling paranoid about people watching him. What absolute rubbish. They're painting a canvas here. They're painting a picture that this patient wants to go through with this, with the author of this report, and Graham Loy and Rebecca Tyson, and they can video record it. It'd be appreciated if they did, and go over every word in this document. Paranoid about people watching him. Seriously. You know, you put things into context, and that's where it all comes to pieces. He thinks he is sleeping more than what the carer thinks. States tends to like to nap during the day, sleep during the night. Then they got questions on it, reverse sleep-wake cycle. So what? He wants to have a nap during the day. He's tired, wants to have a sleep. And here's the one I've got to he's fatalistic about incurable nature of condition. He's not fatalistic about it. He's come to terms with it. He's saying his prayers and he knows he's dealing with it. He's happy he didn't take chemotherapy because he's doing well without it. He's got strong appetite. His immune system's built up. He's eating like a horse. You know, this so-called fatalistic, he's had high dose IV vitamin C, intravenous, 30 grams now for 3 months, every week. Doesn't sound fatalistic. It sounds like he's being positive about it, and he's going for 2-3 kilometre walks sometimes. He's got pain, but he's dealing with the pain. The vitamin C is helping, and he's asked to be given some medicinal cannabis, and just treated like told to get out. Get out. You can't have that. You've got to take narcotics instead. Cannabis is too dangerous. Seriously, these people call themselves professionals. And the report claims he has stopped seeing Dr. Mason, the psychiatrist, and Dr. Alsop as he feels there's no point. Look, this hospital has blacklisted this man. He wants to go there and be treated properly, but he's fearful to go there, even now more than ever. He's fearful. They're just saying, well, you know, to a third party, he feels there's no point. You know, feels they're just ridiculous. He also says he feels he's coping relatively well during COVID lockdown. No, he doesn't feel that. In fact, he is coping very well because he doesn't leave the house much. He enjoys time with his chihuahuas. Right, he does. He leaves the house to go for long walks. Told him all that. Still got muscle in his legs. Dry cough, blah, 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 slurs. The main concern now is able to sleep. He do his noisy. But understanding we would like to exclude acute infectious etiology causing delirium, although appears to be lucid now. I didn't understand that. They forced that procedure on me. It was unnecessary. They said you'll be out of here in 15 minutes if you do that. Anyway, they're going on and there's misinformation here. You know, my carer there was phoned up 3 times on a Saturday night or Friday night it was. David and Sonny and someone, Jessica, they claimed their names were unknown phone calls. And they were basically bullying the carer and say, oh, what did you call the ambulance for? And trying to put words in her mouth, use of fighting and altercation, use of fighting. And 3 times in about half an hour, different doctors or whatever they are, Sonny, David and Jessica, they call themselves. Who knows what name and unknown phone numbers, you know. This is nonsense. They've got to be identifiable. Anyway, they bullied her, made her tears. She was blocked from going in to see the man. They're all part of it. And anyway, on examination, alert, responding to questions appropriately. Hey, that was the case all the time. You know, if you treat people badly, they're going to get agitated, to quote them. All right, they're going to be agitated. Anyway, contrast. Put him for more X-rays and brain scans. For goodness me, they should have done their own brain while they're in there. They just go on. It's just you know, I can't give this to my doctor. I need to have one filled out properly. And the man, he's eating well at home, relaxed and enjoying himself. He's putting on weight. He's not losing weight. 3 days in hospital. Lost 3 kilos. The food there absolutely is indicative of how the place is run. Just a dog's breakfast, everything. You can't even get the food right. You know, good luck with the rest. One doctor commented to the female doctor, she said, oh, you want to walk past the kitchen? Stinks horrible. Yeah, well, see Mr. Loy and Rebecca Tyson, make them eat it for a couple of weeks, all of the mongrels there. Oh, this says, impression unlikely to have meningococcus or acute neurological cause for transient behavioural disturbance given spontaneous improvement. Just trying to justify the inappropriate conduct, you know, and doing a bad job of it. I'm just reading this off the top of the head. The hospital may have supplied small quantities of new or changed medicine. No, the patient, he took his own medication. The ambulance people didn't bring the medication with him. They weren't interested. So the carer come and brought the medication, and the doctors and the nurses up there said, oh, you're taking it, you know what you want, and you take it yourself. You know, the patient's a responsible person. Then they got the medication wrong about diazepam, and you know, look, how can you believe any of this? How can you believe any of it? And the man, as it stands, he's still blacklisted. The complaint he put in back in January, February, they need to respond to that. And they need to respond to this straight away, the people. It's got all this other hobbycock here, has not reviewed during visit. He told these people, incorrect high-dose IV. He said, I'm taking high-dose IV. They said he's not been reviewed. They don't want to know about the high-dose IV because it's doing a good job. An intern neurologist there, named Monica Vagiotis, I don't know if she's Greek or something, but she visited the man and she was quite a nice young doctor. She's the author of the report, but she doesn't put a designation. And through inquiries I've made, she's supposed to be the intern neurologist there. And the doctors who maltreated him and tortured him, and the paramedics and that there, well, you know, the hospital knows who they are. Graham Lewis, director or advisor of Ambulance New South Wales, so he might know something about it. Well, he probably does. You know, these things just don't happen like that. But anyway, the neurologist said his name David, apparently the one highest status, Sonny, and Jessica, take that as you will. But, you know, they would have videos there and saying that there's something wrong, or they're not on a video. No more lies now. Anyway, the good news is he's going very well, this man, and looking forward to the high-dose vitamin C. Neighbours and having good chats with the neighbours, and still fearful, but they're going to pull this section stunt. You know, and the way this discharge is, it's written with that intention, because it's got so many inaccuracies in here. I can see why Monica, the doctor there, she hasn't bothered even putting a designation in, or nothing. And the two doctors there, you know, they should have been doing this discharge report, not poor Monica. By all accounts, sounds like a good person. And the same with the consultant there, Dr. Amy Carr, you know, great person. And this is the sort of representatives you need at Westmead Public Hospital. And the kitchen there, just, you know, the patient wanted to order a pizza. The lockdown, of course, that couldn't happen. All right, thanks for listening, and stay tuned for the next episode. Hang on, not enough.